This is Newsbreak 26 in Southwest New Brunswick. I'm Vicki Hogarth. Here's what's happening in our part of the world. Thousands of New Brunswickers still don't have a family doctor, but one St. Andrew's physician is proactively taking a team-based approach. Dr. Julie Levesque-Taylor says the traditional solo doctor model can be challenging to maintain, especially with growing patient demand.
So you're either shortening your visits to be able to see more people in a day, and you don't get into that in-depth assessment, and you don't get to do prevention, you don't get to talk about mental health, you don't get to talk about, hey, can you afford that prescription for that cholesterol pill or that diabetes treatment that I just prescribed? You don't have time for those sorts of things, or your patients just can't get in to see you. You can say you have 3,000 patients or 2,000 patients, but if you can't get an appointment for a month or two, you're really no good to anybody because you're not getting them timely access.
Working out of the community-funded St. Andrew's Wellness Centre, Dr. Levesque-Taylor is part of Coastal Communities Health Homes, sharing her workload with a nurse practitioner and a registered nurse. Morgan Stevens, a nurse practitioner from St. George, is the newest member of her team.
She is a nurse practitioner graduate, so she worked with me in the clinic for her practicum and her clinical hours over the last year. We clicked. I thought she'd be a great fit for the community. She's from St. George, so she's a local person. She's a 7-year ER nurse, so she's got lots of great experience under her belt. She's a good human. She's fun to work with. Lots of empathy. She's all the things that you would want.
Together, Dr. Levesque-Taylor and her team handle urgent cases, keep electronic records current, and now offer evening appointments so patients don't have to turn to the emergency room for routine care. The practice is also part of a wider network. St. George's physician, Dr. Cherise Dross, steps in whenever Dr. Levesque-Taylor is away, whether she's covering hospital shifts at Charlotte County Hospital or fulfilling other duties, so patient care continues uninterrupted. Much of this has been made possible with support from Family Medicine New Brunswick in collaboration with the New Brunswick Medical Society and the Department of Health to allow for the hiring of additional staff and the setup of essential infrastructure like electronic medical records. With this help, the clinic plans to take on about 400 new patients this year alone. Dr. Levesque-Taylor hopes other communities in Charlotte County will adopt similar models so that more residents can access sustainable, high-quality care close to home. Finally, dozens gathered on Wednesday evening for the Walk for ALS in St. George, uniting to raise awareness, funds, and hope in the fight against ALS, a progressive neurodegenerative disease that still has no cure. Two standout teams, SIDS ALS Stars and Wanda's Warriors, led the way, bringing energy and heart to an emotional day that honored those living with ALS and remembered those lost to the disease. Organizers say events like this are vital in keeping momentum going for research and support services.
It's really joyful to see the community turn out and support Wanda's Warriors and Sydney and I, and not just us, but there's others in the community that are struggling, and so it's very exciting.
We're here because of our sister, Wanda, and it's Wanda's Warriors that we're walking for today. We're from Moncton, but we made the trip down. We walked in Moncton last year, but we thought we'd come to Penfield, St. George, and walk with Wanda's group of friends and everything. So it's just supporting ALS because they have done so much for Wanda. We just want to give back a little bit.
Earlier this spring, Sid Kiernigan and his wife Karen sat down with me on Southwest Magazine to share their journey from Sid's diagnosis of ALS 6 years ago to today. The Walk in St. George was part of a nationwide effort by the ALS Society to fund research and improve the quality of life for people living with ALS. That's all the news I have for you. For more stories and online exclusives, visit CHCO and the Courier online at chco.tv.
A news and public affairs production of CHCO TV, New Brunswick's only source for independent community television.